Dengue fever has been known to exist for centuries, but the first scientifically documented cases date back to the late 18th century. The earliest recorded outbreaks of what is believed to be dengue fever occurred simultaneously in Asia, Africa, and North America between 1779 and 1780. However, the term dengue began to be used in the early 19th century. Dengue fever is a disease caused by the dengue virus, primarily transmitted through Aedes mosquitoes. Initial records lacked detailed descriptions of the disease's characteristic symptoms and modes of transmission, but over time, understanding of dengue fever has become clearer. Dengue fever is transmitted primarily through the bite of an infected Aedes mosquito, specifically Aedes aegypti and Aedes albopictus species. These mosquitoes are carriers of the dengue virus. When a mosquito bites a person infected with dengue, the virus enters the mosquito. After an incubation period inside the mosquito, the virus becomes transmissible. When this infected mosquito bites another person, the virus is transmitted to that individual. The Aedes mosquitoes are most active during daylight hours, particularly around dawn and dusk. They breed in stagnant water, so areas with standing water are high risk for dengue transmission. Unlike malaria, dengue is not transmitted directly from person to person, and there is no evidence of transmission through casual contact, sneezing, or coughing. Preventing mosquito bites is the most effective way to prevent dengue fever. This includes using mosquito repellent, wearing long-sleeved clothing, and eliminating potential mosquito breeding sites by removing standing water. Vaccines for dengue fever are also being developed. Dengue fever begins with a sudden and high fever that can last for 2 to 7 days. Patients often experience an intense headache, often described as pain behind the eyes. Dengue fever is characterized by significant joint and muscle pain, which can be quite severe, earning it the nickname, breakbone fever. Gastrointestinal symptoms are common, including nausea and vomiting. Typically, a widespread rash appears on the skin around the 4th or 5th day of the illness. In some cases, individuals may experience mild bleeding symptoms such as nosebleeds, gum bleeding, or easy bruising. This is more common in severe cases of dengue. Dengue fever can lead to a general sense of tiredness and exhaustion. Please keep in mind that while these are the common symptoms of dengue fever, the severity and combination of symptoms can vary from person to person. In severe cases, dengue can progress to dengue hemorrhagic fever, which requires immediate medical attention and may exhibit additional symptoms such as abdominal pain, persistent vomiting, rapid breathing, bleeding gums, restlessness, and blood in vomit. Adequate hydration is a fundamental aspect of dengue fever treatment. It is crucial to drink plenty of fluids such as water and oral rehydration solutions to prevent dehydration due to fever and vomiting. To reduce fever and alleviate pain, over-the-counter pain relievers like acetaminophen, paracetamol, can be used. It's important to avoid non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and aspirin, as they can increase the risk of bleeding. Rest is essential for recovery. Getting sufficient rest allows the body to better combat the infection. If dengue fever is suspected, it is advisable to seek medical consultation for a proper diagnosis and ongoing monitoring. In some cases, dengue can progress to severe dengue hemorrhagic fever, necessitating hospitalization and intensive medical care. Severe cases of dengue with a significant drop in platelet counts and bleeding may require platelet transfusions as part of treatment. While recovering from dengue, it's crucial to prevent further mosquito bites to avoid transmitting the virus to others. This can be achieved by using mosquito repellent, wearing clothing that covers the skin, and using mosquito nets or screens. Follow medical advice. It is essential to follow the guidance and recommendations provided by healthcare professionals, as they will tailor the treatment plan to the individual's condition. In cases of suspected dengue fever, seeking prompt medical attention is essential, especially if severe symptoms develop. Early diagnosis and appropriate medical care can greatly improve outcomes, particularly in severe cases.